Welcome to Ask Resource Center, Ask an Expert. This is our fifth in a series that we have been doing around mental health, IEP, and behavior. We're very excited this afternoon to have Darcy, May, and Julie with us. Darcy Alt is CEO at Heart of Iowa Community Service. May Hinchen is CEO of Mental Health and Disability Services of the East Central Region, and Julie Jetter is Community Systems Consultant for the Department of Human Services. And they're going to share the changes to the children's behavioral health systems and how to access those services. So welcome, ladies. We're very happy to have you with us this afternoon. This is being recorded. At the end, we will have time for question and answer. I know I took a peek of who signed up, and I know I have some friends that have followed all the way through with our April's webinar series. I just want to let you know that May 11th, we're going to have another one. This one will be at 6:30 when a mental health crisis happens at home. So please sign up for that one. And if you haven't heard or would like to check out our Together We Can conference, we have 3 more. We did a series of 4 on Saturdays, 10:30 to noon. And so this week we have our second one with Ladaric Horn, and he's an advocate for young people and just his own personal journey, struggling with being special ed and then going to college. A great speaker. And so I encourage you to join that one. So, and then you can see what the other 2 are, chapter 103, and then another one around mental health and taking care of oneself. So I'm not going to slow us down because we want to hear these 3 ladies and what they're going to share with us. So thank you so much. And if you have questions or need support in any way, you can put it in chat and Karen and I will be glad to help you. So welcome, ladies, and I'll turn it over to the 3 of you.
My name is Julie Jetter, and I'd like to welcome you this afternoon to talk a little bit about children's behavioral health and the system that's been being created and some of the things that have happened. I'm going to start out with the history. As you know, today already we have Darcy and May are both regional CEOs, so they're going to be able to give you some really good examples of what's happening around the state. But I am going to start out with a little bit of history. How did we get here? Well, about 3 years ago now, Governor Reynolds issued an executive order to establish a mental health system for children. And through that, there was a Children's System Board created, and they were to establish a strategic plan with recommendations on how to create a children's system. And they did that in November of 2018. And from that, we received House File 690. That was signed into law in May of 2019. So that's actually been 2 years ago. And it is the children's behavioral health system that is currently in place. We also will find that there are requirements in Administrative Rule 441, Chapter 25. One of the first things that happened was there was a new children's board created, and with members that are appointed by the governor. And they have some very specific responsibilities. One is to advise our administrator of the MHDS division of DHS on how to provide the services or what services are needed in the children's system. They consult with agencies on implementation of the administrative rules, and they identify outcomes and indicators for eligible children with serious emotional disturbance, to promote children living in their own home with their families. That's our key. Each December 1st, they send a report to the governor and the legislature, and all of the information about this children's board is online on the DHS website. So the presentation has a link to that website. It's also here on the screen. And I know that this is going to be made available to you so that you can get there and check it out. You can find out who the members are and what their current agendas are, minutes, and reports, all on that website. Today, we want to spend a little bit of time talking about the mental health and disability services regions in Iowa and their responsibility with the children's system. There's quite a bit of work that has been done, and I want to review a little bit of that with you. Regions had to really spend some time understanding what children's services were available in their community and what those gaps were. So they have convened and facilitated children's advisory committees to help identify what needs are out there and what gaps are there. Their regional governing boards actually have children's system members now present for all the governing board meetings and are active governing board participants. They also have, all 14 regions have at least one children's disability coordinator on board and working with the residents of their region. Funding for services for children who meet eligibility requirements. So the regions, although they are providing access, their funding might be just a little bit less just because they're only responsible for funding children with the serious and emotional disturbances whose families are at or below 500% poverty. Now, that doesn't mean that access isn't available for more children. This just talks about the funding. So the access is much broader and a much broader requirement. There are two sets of services, and if you talk to regions out there, you'll often hear them referenced as Tier 1 and Tier 2 services. But the Tier 1 services are core services that had to be available as of July 1st of 2020. And the Tier 2 services have to be available by July 1st of 2021, which is coming up in just a few months. I want to walk through those services. This is a list of services I'm going to review with you. And then in the parentheses, you'll find the access standard to those services that helps you understand how access needs to be provided to them for the residents of the region. So the first service is assessment and evaluation related to eligibility for services. And again, this is the Tier 1 services. So all of these are available within your regions now, and they have to meet the access standards by July 1 of 2021. Many of them already do. So for assessment and evaluation, that has to be available within 4 weeks of the request and within 30 miles in an urban area and 45 miles in a rural area. Behavioral health outpatient therapy, again, that has to be available within 4 weeks of a request of the service and within 30 miles in an urban area and 45 miles in a rural area. Education service is at least 4 times a year, and that's going to be education for the children's behavioral health issues. Medication prescribing and management, that's to get those meds, to get a prescriber involved and to help monitor those medications. That's within 4 weeks of the request, and again, 30 miles in an urban area and 45 miles in a rural area. Prevention information, that is 4 activities within the region per year, and to talk about prevention of children's behavioral health issues. This next set of services is the Tier 2 services. So these are the ones that would be available or need to be available this coming July 1st of 2021, and also the corresponding access standards for those. So the first one is behavioral health inpatient. That has to be within a reasonably close proximity, which is defined as 100 miles from the residence of the individual and within 24 hours of the need of the service. Crisis stabilization community-based services. This is a face-to-face service, and it has to be available within 120 minutes of the request of the service once the child has been referred for the service. That's going to be a service in the kiddo's home, in the children's home, or where the family is most safe with that service. There's also crisis stabilization residential service. It's essentially the same type of service, but it's actually in a residential setting away from the home, the individual's home or the child's home. And that also has to be available within 120 minutes and 120 miles of the residence of the individual. Early identification and early intervention. Those are things that have to be available within 4 weeks of the request. And mobile response. That would be face-to-face contact within 60 minutes of dispatch and available 24 hours, 7 days a week. For reference, this is a map of the mental health and disability services regions in Iowa. We have 14 of them. And so you can kind of see maybe where you're located or which one would be your region. And we want to tell you a little bit about what's happening. Certainly there, in the first year, there was a lot of development of getting an understanding of who the stakeholders were for regions, understanding gaps and figuring out what needs to be built, developed. So there's been engagement with families, providers, community stakeholders, organizing advisory committees, and discussing funding resources, because not all the funding will come from the region, but the region is the one that's doing the coordination. And identifying service gaps and workforce shortages, which is a concern in Iowa and is constantly being worked on, but does come up time and time again. So now I'd like to turn this over. We want to give you some real good examples of what's going on in regions. So first up, I'd like to turn this over to May Hinchen, and she is the CEO of the East Central region. So you can see some of the counties that are covered by that region. And May, I'll turn it over to you.
All right, thank you so much, Julie. Good afternoon, everyone. Appreciate this opportunity for us to share a little bit about the MHDS regions and our involvement with children's services today. Gosh, it's been a year and almost a year and a half ago, we began our planning for children's services. If you remember from those two tables that Julie showed you, that we were required by code to start implementing services of July 1st of 2020, so this fiscal year. So prior to that, we did some planning, and we had this was our planning, our timeline, and the activities that we wanted to make sure that we did in order to ensure that we were, first of all, following the administrative rule in the Code of Iowa and fulfilling our responsibilities, but also making sure that we were coordinating the services and getting a lot of input from people in our communities. So we asked a lot of questions in a few month period. So you can see the legal responsibilities that we had. We have a 2080 agreement. So our 9 counties in our region, and every region is made up of a different number of counties, but we have a 2080, which is an agreement between governmental agencies that they'll band together and work together. So we have always had a 2080 agreement linking our 9 counties together in the East Central region. And in our 2080, we talk about who is on our advisory board and who's on our regional governing board. And as Julie pointed out, some of those memberships changed with the addition of children's services. And so we also have the language around children's services. So we had to update our 2080 and make sure that we're providing all of the requirements in the 2080. And we had to have our regional governing board approve that. We have a regional governing board is made up of 1 member from each of our counties from their board of supervisors group, as well as an adult services provider, a children's services provider, and then we have a family member of a child who accesses services and an educational representative. So some changes there with our governing board adding on those children's representatives. So the next thing we did was seeking input, or we sought input about what services were needed. So we did a service mapping. That was my staff and I, just to say, what services do we have available in our counties? Do we have everything that we need as far as the letter of the law, but also are there things that we should develop for the spirit of the law as well? So in February of 2020, we sent out a survey across our 9 county area, and I'll share some of the results with you in a minute, but we sent out a survey just asking some really broad questions about what people identified as needs for children's behavioral health, as well as obstacles that they saw for those services to be implemented. We were extremely pleased. We sent out the survey. It was shared widely. So I don't know how many people received it, but we actually had 498. So we had almost 500 responses, and we were really pleased with that enough people were interested and really, engaged with children's services to give us their input. Once we had the input from the survey, we, like I said, there were very intentionally broad questions. So we took the input from the survey and then we dug a little bit deeper. And in each of our 9 counties, we had what we called focus groups. So we developed a list of more specific questions based on the input that we got from that survey. And then we really sat down with people. This was prior to the pandemic, of course. We sat down with people face to face and said, tell me more about this or talk to me about that. So got initial input and then got a little bit more input. Then we were required to submit a plan to the Department of Human Services about our implementation of children's services. And we have some other policies and procedures that we needed to add children's language to. So we took care of all of that by April 1st of last year. And then, of course, we had implementation on July 1st of last year. So we made sure that we had a children's coordinator assigned. We got that advisory committee together, and we revised our management plan. That's our policies and our procedures. But also, really importantly, is that we ensured relevant partnerships and contracts were in place. So this system, from this process, from this last year and a half, has really been about creating awareness and building partnerships with the people who are certainly very critical to us implementing a little bit more comprehensive system for children's services. So I wanted to share with you a few of the questions that we asked on that really broad survey where we got so much input, and just some of the responses. So here it was, what services do you think are needed? And if you can tell by the colors, and I know there's various shades of blue, but counseling and therapy were identified as the most common recommendation or request for services. And then we also had access as is a big issue for people. And when we talk about access, that can be a lot of things. That can be distance to a provider. It also can be the length of time it takes to get into a provider. So you saw from Julie's slides that there are certain requirements, but the amount of time between a referral is made or a person requests services that they have to get in. So we saw that access was a concern for people as well. One of the questions we said, what are the barriers? Like, why are children's behavioral services inadequate, or just what are the needs? What's getting in the way of services being implemented in our 9-county area? We see a lot of people identified funding, right? So in this transition from other funding, maybe no funding for some services for a certain group of people, to regional funding, hopefully we're going to take care of that issue for a lot of people. But people really understood, like, there was just not enough money, still not necessarily enough money to provide children's behavioral health services, but we are able to create mechanisms for people to be able to access some funding that they didn't have before. The other thing too is just lack of providers. You know, we have in our region, we have 3 more urban counties and 6 more rural counties. So some of the people really identified the more rural counties that they have a hard time finding a provider and maybe have to travel quite a distance to find somebody to provide that support. This year, the year that we're almost finished with, we've got about 7 more weeks of this fiscal year. It ends June 30th. So if you remember from that tier 1, the services that we're responsible for implementing this year. So we implemented all of our tier 1 services. We're pleased with our ability to get those in line. And you may have remembered that mobile crisis outreach was a tier 2 service, a service that was intended for implementation July 1st of this year of 2021. We've actually been providing mobile crisis outreach for children for several years, and so have a lot of regions. So just because it was required July 1st of 21, we didn't stop doing it for a year. We just kept providing mobile crisis outreach for children, and really are working with our mobile crisis outreach providers to ensure that they have adequate response to children's situations with the developmental needs of children, as well as to the locations where children will be. One of the other things that we did was we listened to our providers, and they had a big concern about the amount of time that, because they're children, they aren't able to advocate for themselves and they're not able to make decisions about their treatment themselves, that providers spend a lot of time talking with parents, talking with schools, maybe other treatment providers, and that's not a billable service. So we made the decision that we would fund what we call collateral time. So if a child is eligible for our services, we will fund 2 units of collateral time each month for that service. Because really, I mean, we looked at it from the standpoint that we want to develop this system, and we want to have a lot of collaboration. We want to have a lot of partnerships between providers and schools, and providers and families. And so we wanted to recognize that, acknowledge it, and honor it with some funding. Other policy, it has looked a little different than we intended because of the pandemic, but we are implementing yoga and mindfulness as a prevention effort with children in our region. And we had initially hoped to have a lot of in-person and yoga and mindfulness lessons for children, but with the pandemic, our provider had to pivot and has done a wonderful job with offering virtual. So we have 52 schools in the East Central region who are implementing virtually yoga and mindfulness with elementary age children. And several of the regions in the state also did that project just because it's helping children to deal with the stress that they're experiencing because of the pandemic. CARES Act, and so like I said, the pandemic has created this opportunity for us to change direction on some of these things and actually to layer on additional support. So the governor in July allocated $30 million of the CARES Act funds to the MHDS regions, and we all got a share based on our population. So across the state, we've done a lot of innovative and important things to help children and families to receive support from the impact of the pandemic. So we have a project, we had 4 projects that provided support for children and families in our region. We have all 9 counties covered, and in 3 of our projects, some of them cover more than 1 county. So we certainly have all 9 counties covered. We have a program that's called Parenting in the Pandemic that was just completely web-based resources and lessons that parents can go to this website and just help them to deal with the stress and the worry of the pandemic, as well as to foster resiliency skills in themselves and in their children. So we also provided some support for school staff. We were very concerned back in August that teachers were dealing with a great amount of stress because they were going back to school after having been out of school for 5 months. And so we have a project where we will fund what we're calling 3 mental wellness coaching sessions. It's just some general advice about how to deal with the stressors, the worry, the guilt, the anxiety, the sleeplessness that is associated with some of the stress of the really unstable environment that we had last August. Schools were going in person, and they were switching to out of person, and there was hybrid, and it was really like an ever shifting environment. So we wanted to provide some support for school staff so they could do the 3 mental wellness coaching sessions. And then if they still had needs that were not met, they could have 2 outpatient counseling sessions that were completely free of charge, no questions asked, no insurance billed. They just had to identify that they were an employee of a school district in our region. And that we implemented that as soon as we could last August to try to get that support in place right before children came back, because we really believed that if the adults felt better and the adults felt like they were coping better with the stressors of the pandemic, then they would be more valuable to children when the children arrived at school. So talked about the yoga and mindfulness already. We also offered mini grants to schools where schools could apply for funding through our CARES money for things like PPE and brain health support and social emotional learning curriculum and skill development and other equipment to help them to mitigate some of the requirements that were in place for children to be present in schools. And the last one, the school region collaboration, that's the one that we actually are pretty happy about. We have a strategic plan. In our strategic plan for this year, a priority for us was to develop relationships with school districts and create awareness of the region. Because we're new, so to speak, to children's services, not so many people across the region and in our school districts were aware of the East Central region and what we do and how we do it, and in the other regions across the state as well. So we had a priority that we wanted to develop relationships. And the CARES Act funding, because we had money that we could offer, we were sending out emails, we have money, apply for money. Kind of the unintended consequence was, besides offering money and gave them that support, was it really helped us to build relationships. And so I really feel like we're much further ahead in our relationships and our collaborations with school districts than we would have been had we not had CARES Act funds. All right, so our plan for this coming fiscal year. So July 1st is right around the corner. So our plan is to continue the implementation of Tier 1, of course, mobile crisis outreach, collateral time, and yoga and mindfulness, all of the things that we are doing in this year, and then the implementation of Tier 2 services. So contracts with hospitals for inpatient hospitalization, those crisis services, as well as early identification and early intervention services. We are planning we don't have a better term quite yet, but a Children's Behavioral Health Summit in August of this year. It'll be a virtual event that we are bringing children's behavioral services providers together in schools and different funding streams and really creating some awareness, because there are a lot of people and there are a lot of systems working in this sphere around supporting children, but not everybody knows what everybody does or what everybody's requirements are. And so we're trying to build some awareness. And I think that's really our first step to really having this system where people are talking with one another, people are building relationships, people understand what other service agencies' expectations and rules are that they have to follow. And then we're going to have a really big discussion about what are more barriers and keep moving forward from there. That's a little bit of what we're doing in the East Central region for Children's Behavioral Health Services. And after Darcy goes, I'm happy to answer any questions you might have.
May always does such a great job that I don't feel like I have to talk as much. So my presentation is always a little bit shorter. So I can get more into the heart of what we do in the heart of Iowa. We do a lot as far as working directly with schools, working directly with families. And to take it back just a step, as far as what the purpose of Regions and children's mental health, I really do think it's very simple. When we were working on the development of the children's system, I worked closely with DHS. We had a lot of conversations about what this actually looks like. And I really do think that when it comes right down to it, we really are that one call. And a lot of families were getting very stressed out. They were getting very to the point of having to make a lot of calls to figure out what they needed to do. And that's really difficult. If you've been in that position of not knowing what to do for your child, and then you're tasked with calling, you think you're calling the right person. And then once you've told your story and you figure out that that's not the person for you, and then you have to start all over again. And then you find out that person is not the person for you. And at the end of the day or the end of the week, you've made 7, 8, 9 calls and you've never called the right person. And you're in the shoes of that family member. It is very taxing. Plus, you're in a stressful position with your child, not knowing what to do. I really feel like as Regions, it is our job to be that one call and figure out where you need to go for services. And if it's in our wheelhouse to make a warm handoff and help those families figure out where they need to go and help with those resources and those referrals, then that's what our job is to do. Because families can sometimes be in very difficult situations where they just don't know what to do. So first and foremost, I do feel like that's our role. Because a lot of times we get calls from law enforcement, we get calls from schools, we get calls from families. We may not be funding anything at all, but we're helping to get people, families lined up with services because they may have insurance that funds those services. And if we can call and check in with them occasionally or help get them lined up, that may be our only contact with the family. And I think in our region, we probably get 8 or 9 calls a week. And that's all that we do. It's very rare that we actually fund something for a child. And a lot of times when we're funding something, it may be mobile crisis or a BHIS service or something like that. We may be funding something indirectly, or they may have insurance that isn't covering. So we're looking at that 150 to 500%, and we're filling in the gaps. So that's a big part of what we as Regions may be doing. I know that's what the Heart of Iowa region is doing. So a lot of what you're seeing on the screen now, we go out to schools and we feel like a big part of our role as far as schools or providers is to help develop those relationships. We develop access to services, whether it's at a hospital, a school, helping to get a mental health provider into the school in order to make sure that there's therapy available within the school. So in our region, we've ensured that there are counselors available at the schools. We've helped to introduce a lot of the therapists at the schools within our region and help to make sure those services are going on. One of our favorite things to do within our region, we've done this for about 4 years now. We do school mental health fairs where we go in and we spend a day. We do different sessions in our middle schools and we talk about different mental health issues that come up. We feel like the middle school age is a really good age group to do that with, to provide awareness of mental health issues, to go through different topics. We might have a 1 hour session with NAMI talking about maybe lived experience, and then we do different breakout in a gym where we have 10 minutes going through maybe coping skills or body image, or have the sheriff's office there, substance abuse provider. We set it up different ways. Last year, we brought in Royce White, who had played for ISU. And after we did the mental health fair part, he gave a presentation in the afternoon. We actually took him around to 6 different schools, and that was very well received. We, as far as mobile crisis goes, we do have a law enforcement model within our region. But when it comes to schools, they have a direct agreement with our mobile crisis provider, so law enforcement isn't called. And that's how we've chosen to work with our schools. We know that when it comes to schools, the schools are professional enough to be able to direct mobile crisis on whether there's an issue with safety or anything like that. So we just have set up separate agreements, so law enforcement isn't involved. Another thing that we have done statewide with all of the regions is we have an AA summit. We started doing that last year so that regions could start working directly with their AEAs, build those relationships and make them stronger. We're going to have our second AEA summit coming up in June. From that summit, the AEAs began to meet regularly with their regions and build those relationships. I think that has been extremely successful. We also do a mobile crisis summit. We had our first one last year. We're planning to do our second one in May. When it comes to mobile crisis, we do often have providers that work both with children and adults. In our region, we've had mobile crisis since 2009. We very much follow that model where they're working with both children and adults. They've been trained in both youth and adult mental health first aid. We get them additional training as needed. The region does fund a lot of the training that our mobile crisis providers receive. That way, we oftentimes are the one helping to provide the training, but also we attend the trainings with them, just because in our region, we work very closely with law enforcement and we can assist them with whatever their needs are. We receive a lot of direct referrals from mobile crisis and from law enforcement, so it works really well. If they're working with a child that there's an issue with the family and the family is called, a lot of times rather than putting charges on the child, they'll make those referrals directly to us rather than to juvenile court. We do a summer peer readiness camp. That is for any child getting ready to transition. That's 8th grade through graduating. If they have an IEP or a 504 in their school, then they are appropriate for our summer peer readiness camp. It's a 2-week camp in the summer, and it is funded at this time by the region. It gets them out into the community learning social skills, career skills. They go to visit a lot of potential employers and get to tour those sites. Now, last summer, of course, they actually just mainly stayed on site. It's located within my building, so they stayed on site due to COVID, of course, but they set up certain job skills. They set up certain social outings, those types of things, and help them learn certain skills. It's a pretty cool thing, and we're really excited about it. That came about, I had a meeting with our local AEA and some teachers. It was pretty much 4 years ago. We had a meeting, I think it was in March, and I asked them, if you could have anything, what would you want? And this was something they brought up, and within a couple of months, we had it set up and ready to go for the first time. In our region, we do service coordination for all of our counties, and we are a small region. We're only 3 counties, but we love all of our counties. We have service coordination for both children and adults. We've had that, well, we've always had that. We believed even when the MCOs came in and we were no longer doing targeted case management, we understood that there were children that were still going to need services. So we never stopped doing service coordination for children. And a lot of that really was the resource and referral. So we just continue to do that. Through our CARES Act, we haven't still continued to do prevention and education. And what the CARES Act dollars have helped us to do is provide more supports and resource materials. We have done things like poster campaigns for the schools, resource guides. We understand that a lot of things are being done via the internet, but when folks really need those resources, they aren't always able to get to a computer, or when law enforcement is interacting with somebody, they need the resources now. So we've done resource guides and things like that they can just grab and hand to somebody. Increased supports for families and students. We had requests through schools to increase their ability to provide counseling. We had requests for increased training for teachers, guidance counselors, things like that. So we did provide those through our CARES Act dollars. Like I said, we did education and marketing. We had one school that requested the sensory rooms, which were really cool. I have gotten to see pictures because they have it done now, and I really want to go visit it. It's in our Exira Elementary, which is located just right on the edge of our region. And I got pictures of it last week. It's all done. And I am going to go hang out in it the first chance that I get, that I have an afternoon free. So it's been pretty cool that we've been able to do some things like that. There's the DHS website. All of the regions are very collaborative with each other, and we were able to develop a website that you can go to, mhdsregions.org, and it's pretty cool. You can go there, and if you're not sure which region you're in, there's a map that you can click on where you're located, and it will take you to your region's website. So that's available to anybody. Your region's website should tell you what services are available to you and what you can do. I also would mention that a lot of the regions are working with law enforcement to do CIT trainings. They're working with their crisis providers. I know in our region, we're doing a lot of crisis trainings and law enforcement trainings. I work closely with the Law Enforcement Academy, and we're doing their CIT training. So we're ensuring that they're learning how to work with children, how to refer to their regions. That's one of the reasons that I've gotten involved with the Law Enforcement Academy, is because we do provide them resources to help them to get in touch with their mental health regions, because we want to make sure that those partnerships are going on.
Well, thanks. Great information. So we've got a couple of questions, and I'm going to actually start with the family questions, and then we'll go to the more global questions around how you engage with families. So, and this is just real life scenarios. So Sarah writes, I'm confused. My son has had 3 ER visits from August to February, August 2020 to February 21, where we stayed in the ER from 3 to 5 days and never had an inpatient bed open up. The latest one in February was for a suicide attempt. He's 11, and the ER had to discharge us after 5 days because there wasn't anything available. And they were at, well, you can see St. Luke's, Jones Regional, UIHC. So, and then another one just talked about that it's like I call, but all I get are lists of people that I'm supposed to call. So I think it's really important that we start with real life examples that maybe the 3 of you can touch on, and then we've got a few other more global questions in there, if you wouldn't mind.
I'll start. I think those are really good questions and really good things to bring up that are real life examples of what's happening, which is further demonstrates to us that we're just beginning to develop this system and to provide these services, and we're not there yet. One of the things that you saw for us that we're responsible for developing July 1st of this year is crisis stabilization residential services, not hospitalization. Perhaps, if you will, just loosely consider it a step down from hospitalization. I'm really hoping just in our region, which Sarah would encompass, I think, where you live, perhaps, that with the addition of crisis stabilization residential services, that some children can be moved out of those very limited hospital beds to free up the hospital beds so people can get in more. I mean, yes, there is a limited number. There is not enough beds for children who need inpatient care. The other thing is, whether it's stepping down from hospital or maybe as an alternative to hospitalization, that the availability of crisis stabilization residential beds might be able to be that alternative. So I don't keep hearing stories like yours, because I've heard lots of them, and that I know how frustrating it is for you. I know, like, it for us, it's just like, oh my goodness, these people need support and they need help. So we're getting there. And those are the things. And that's why, that's why the state legislator asked the regions to develop these services, and why we're taking what they have asked us very seriously, so we can prevent more situations like yours from happening.
She's been given lists, and all she does is, so does somebody want to speak to that? Because that's what families want to know. How do they move it forward?
So I just a clarification, they're getting lists from the regional service coordinators. Is that what's happening? Or they're not getting a hold of the regional service coordinator?
She says, I have a list of about 6 people that are supposed to be able to help me locate services. All they do is give me a list of phone numbers, and some of the resources aren't even close to what I'm looking for, or the providers don't have openings. I'm on a 3 wait list for ABA, and they're 3 years long. I need less people giving me lists and phone numbers and more service providers, which I'm not surprised in hearing that.
So how about you email me directly, and then I can maybe help problem solve through that.
That would be awesome. Thanks, Darcy, very much. So I'm going to start kind of backward design, because this is a very popular topic, and we've heard about it a lot from different organizations. Are officers serving as school resource officers required to receive crisis and mental health training?
No, they are required to receive like an hour or 2 a year. And I don't know that the school resource officers are required to get anything additional to that. One of the things that we are tasked with as regions is to get CIT training out to law enforcement. Now, I'm going to be really, really honest with you. We're mandated to do that, but law enforcement isn't mandated to take CIT training. So, we always have that kind of inner struggle. But what's been really awesome is everybody who goes through Law Enforcement Academy is now getting that 40 hours of CIT. And we do it at the Law Enforcement Academy. Polk County does it, or Des Moines PD does it. They do their own. So we know that probably for the last, I want to say, 4 years, I know I've been involved with it, you've probably had 300 each year getting that CIT training at the Law Enforcement Academy alone. And then you've got several regions out there putting law enforcement officers who have agreed to come through it. They're getting it. And I know that other trainings are being provided out there as well, not just the CIT. So officers are getting it. They're coming to the table for it. And we're just working hard to kind of get it out there and get it done. So I don't know that you want to approach that officer and ask them what mental health training they've got, but I know that they're trying to get that training in.
Thanks, Darcy. So Karen asked about the Mobile Crisis Summit. So how do people find out about it?
What we're doing is we're coming together with all of our mobile crisis providers as the regions and working on whatever issues we have going on. So that's what we kind of do with that Mobile Crisis Summit. And they may be issues regarding rollout of the new 988 that's coming out. It may be payment issues. It may be methodology. What types of things are other mobile crisis providers doing that maybe we want to do? So it's really kind of one of those things where we're looking at how do we be more consistent, or are there things that other people are doing that maybe we want to do? So it's kind of a day-long brainstorming session among all of the mobile crisis providers. And I actually organized that.
Great. So what are the best ways for families to get involved and help build and improve the system? Because, they're the end users at the end of the day. Are there ways that we'll know when there are openings at the state, regional, and any local advisory groups? Because Ask, of course, can help message that. And then how do you, that feedback piece, how do you collect that? How do you continue to improve in the system with the end users, which are family members?
Well, in your local regions, I think you contact your CEO. We do, a lot of times we have a hard time filling spots on our advisory because we do have family member spots open. So you might want to make yourself available to your region. There are a lot of times you can keep track of the minutes, make yourself available for questions, those types of things. So I know when I'm using my advisory group, I'm asking. I have a website that I'm redoing right now. I want to make it family friendly. I want to know what else can we be doing. And knowing that I have a pediatrician on my advisory and I have family members on my advisory and I have folks that work in the children's system, I want to know what services am I lacking? What are the needs? Where are people falling through the cracks? So if there are things going on, I want to know about that. And that's what I'm using my advisory for. But then the Children's System State Board meeting is open to the public. So if folks are wanting to listen in, and there is time for public comment on those. So that might be a good time to express if there's an issue that comes up during that. But those minutes and the agendas are posted on the DHS website, so you can go there.
I wanted to make sure that folks knew that at this website, not only can you get access to the Children's Behavioral Health Board information, also in this site, all of the CEO contacts are available. So if you go to this website, you're going to find a list of CEOs and phone numbers so that you can contact your region and get plugged in. Because when Darcy said that there are regions out there that are looking for members, it's very true. It's hard to find people willing to serve on the advisory boards. We need active parents and active families on those groups. So I would encourage you to contact your CEO and get involved.
I would just add on to that too. I mean, everything that Darcy and Julie said is absolutely true. Even if you're not an assigned member of the advisory committee, our advisory committees are open to the public. You can just be a guest and listen in and get what we're doing in our region. I'm sorry, there's construction in my building. It's really loud. And the other thing too is on all of our websites, you should be able to locate the children's coordinator or coordinators in your region. And the CEO, of course, always the person to reach out to, but so are those children's coordinators.
Great. It sounds like you guys are open and accessible and want to hear from families is what I'm hearing you say. And Julie, they just need to go to the DHS website.
If you go right to this link that I've provided, you're going to find that you have a choice of CEOs or you have children's service coordinator lists right there. So you can click on it, find your region. It should be very easy to access.
I think this is an important one because middle school and high school are tricky areas, right? And so we hear that, they don't want to go to the therapist in school, right? They don't want to be singled out. Are they receiving services at locations that aren't in their school? Are there off-campus options? Can you speak to that a little bit?
Every region has contracts with providers who don't provide services at school, who only will provide it off school grounds. The other thing too that I want to point out is silver lining of the pandemic is telehealth is so much more common and so much more accessible. So a child could at school just be in a room by himself talking on the computer and nobody would know who he was talking to. It's different than watching the counselor walk into the building. Everybody saw the counselor walk in. So telehealth, certainly available, but available from home, available in lots of venues. So I think that that's been one advantage for us, that we've all gotten a lot more used to accessing services like we're doing today, right? Virtually. And I've had counselors that I know tell me that they feel like they're really connecting better with kids via telehealth because kids are just so much more open to it than some adults, especially older adults. So certainly there are options.
Great. How are we making sure we're communicating with districts? That's that's an entry point, right? And so, and then how are you informing counselors and all of those things, and how are they going to know about the mini grants, and just, because parents want to know, how are their schools going to get involved with this?
All of the regions are working with the school districts in their regions, very actively trying to plug in with them and get that information out. The number of mini grants that went out to school districts across the state of Iowa is very large from the regions. They did an excellent job reaching all of the school districts. And so if you, again, are concerned that maybe your school district isn't plugged in, then I would say contact and find out if the region's working with your district.
Yep, good point, Julie. Thanks. What do you recommend to a parent that would like to access services available, such as therapy? Who should they talk to first?
If they have questions about funding, if they don't have insurance, they can certainly contact their local office, their region, and discuss funding options. As far as needing resources, we can also be a good resource. But if they have insurance, they can just go ahead and contact whoever they want to contact. A lot of times it's a hard system to navigate if there's a lot of different therapists in the area and they want to know who might be a good person for their child. We can offer good assistance as far as letting them know who might be the best one to work with their child based on what their child's needs are. So they shouldn't hesitate to call us.
Great. Somebody was asking about, they're not with the whole COVID thing, that not so much being allowed into schools. So is there like support in helping schools pivot, I guess, to telehealth and understand how they can make that happen? Julie, I see you shaking your head. Do you want to speak to that a little bit?
I just want to point out that a lot of the funding for COVID and the information and equipment provided by regions was to do just that. And I don't know if May or Darcy want to go any farther, but there's been a lot of work around making telehealth available through schools. So,
all right. Well, thanks everybody for joining us again. May 11th, 6:30, we're going to continue the conversation and have another speaker around the whole mental health piece. So, but Julie, May, and Darcy, thank you so much for sharing your expertise. And I'm getting thank yous and great information. So this will be put on our Ask website. Well, thank you so much. And I'm sure we'll circle back and hear more as you guys begin to journey and grow all of this work. So lots of thanks to all of you.
Thank you for having us.
Thank you.